So basically, I will try to share with you all, okay, within 1 hour or more, depending your questions. Okay, so these are the presentation outline for tonight. Okay, so first we will recall about aim of housemanship training. Okay, so that bila kena faham dulu and kena ingat balik kenapa, what is the aim of HO training, then baru kita boleh pilih hospital yang suits the aim of HO training tu lah. Okay. Okay. So next is then the criteria of the best hospital for a HOship. This is from my point of view. Okay, if you hear from different people, you might have different opinion. Okay, so but this is my own experience after dealing with 1,000 of house officer for the past 9 years. Okay. Okay. And next is what to expect from your hospital. Okay, what to expect from your hospital in terms of exposure. Okay, exposure of training, exposure to do procedures. Okay, in terms of workload, working environment. Okay, benign ke, malignant ke, ascension rate, and a few other things to expect from your hospital. Okay, okay, and we also will debunk common myth, okay, about hospital review. Okay, ni I list down the common ones lah. Okay, kalau Lush hospital biasa orang cakap, wah, very busy, very good. Okay, you will have enough exposure. Is this true? We will discuss later. Okay. Small hospital, not so much case, you won't learn much. Okay, you frequently hear this as well. Okay. And then that hospital have a lot of malignant people, so ramai houseman dekat hospital tu kena extend. Okay. On the other hand, you will hear some review that some hospital have very good working environment. All of the people are kind, apa semua ni. Okay. And then, okay, dah ada yang komen. Okay, Muhammad komen. Okay, nak any hospital luar Melaka sebab nak merantau. Okay, so some people want to go to different state during housemanship, so that they can apply to be near their family during HOship. Okay, so I will touch on this as well. Okay, and I will touch about deferring atau postpone you punya housemanship as well, because quite a number of you asked about that. Okay. So if you have any questions, feel free to ask in the comment. I will try to answer along the way. Okay. And then, okay, please share this live session on your personal Facebook, on your batchmate groups, and you can tag your friends in the comment as well. Okay, so we have first question here. Siti Nazratul Ezdiani, apakah kelebihan kekurangan HO kalau di HPU? Oh, hospital university. Okay. InsyaAllah I will touch on that. Actually, malam ni kalau boleh saya tak nak mention any specific hospital lah, because this is a public session. Okay. Regarding hospital university, we have 3 kan, USM, UM and UKM. Nanti I bagi tahu lah apa the common things, but actually I have different review ataupun different opinion about these 3 hospital lah. Okay, so my advice will be different for this 3 hospital. Okay. Okay, so basically kalau hospital university ni, you will have access to more teaching. Okay, relatively the working environment is better, tapi bukan bermaksud semua orang dekat hospital university ni baik-baik, ada juga yang malignant, but the percentage is usually lesser compared to KKM hospital because it's a teaching environment. Okay. Apart from that, the workload is actually more or less the same, if not more, okay, compared to KKM hospital. Biasanya orang ada some perception that hospital university have lesser workload compared to KKM, but actually when I did an official survey, okay, among the hospital university housemen, the workload is actually comparable to KKM hospital, and some hospital university have actually more workload compared to KKM hospital. Okay, so don't forget to stay till the end of session. Okay, so I will, as usual, we will have 3 lucky doctors to win the free seat for clinical skills workshop on 21st March, Sunday. Okay, so yang nak masuk houseman tu, if you think your clinical skills are already rusty a bit, ataupun if you graduated from overseas hospital with very little exposure on hands-on procedure, okay, so you can join Medicop Clinical Skills Workshop, where we train you to do 10 procedure in one day, and additional 4 procedure we will demonstrate to you. Okay, so this will be a full day hands-on. It's a small group, and you will have opportunity to do multiple attempt for each procedure until you confident lah, under direct supervision from our facilitators. Okay, and I will have announcement about our new ONG online course and orthopedic online course towards before we end our session tonight. Okay, so if you're interested, you can stay till the end. Okay, so let's begin our session. Okay, so these are the latest list of hospital available during e-houseman. So I have add on Kuala Lipis, Langkawi, Keningau and Shah Alam is the new addition to a HO training hospital. Okay, but this small or new hospital might not be available every time during e-houseman lah. Okay, but for April intake, we are expecting a large intake because the first intake of the year was delayed. So most probably, if they combine two intake in March, so akan ada banyak vacancy. So more hospital will open up during e-houseman lah. Okay, so from this list, what you need to know is whether your hospital of choice, okay, is secondary, or we call district hospital with specialists, or the so-called small hospital, or whether your hospital is a tertiary, or what people usually call big state hospital. Okay, first, and secondly is whether your hospital is computerized, fully computerized. Okay, fully computerized means no file, no BHD, so you type everything. Or your hospital is manual or hybrid, means ada BHD lah. Most hospital are now a hybrid, maksudnya in terms of your investigation, you need to order in the computer system and you trace in the computer system, but documentation during round, you will still need to jot down in BHD or case file. Okay, so you need to know whether your hospital is secondary or tertiary, okay, smaller district hospital or large tertiary hospital, referral hospital, and then whether your hospital is computerized or traditional, or what we call hybrid hospital. Okay, so next, okay, so before I continue our discussion, okay, so there's a few disclaimer lah. Okay, so first, the aim of this session tonight is not to bagi tahu you hospital ni bagus, hospital ni tak bagus. Okay, bukan. Okay, the aim is to correct your expectation towards your future working hospital. Okay, what you need to expect from your hospital. Okay, so I think a lot of you have receive review, okay, about certain hospital. Okay, so I would like you to disregard atau or macam abaikan je those review, because most of the time the review is bias. Okay, bias kena sebab apa? Sebab houseman tu dia hanya ada experience in dia hospital sahaja. Okay, so mana ada orang yang buat housemanship 2 atau 3 hospital so that they can compare kan. Okay, so if you only have one hospital, so your review tu macam mana, it could be exaggerated and biased based on that personal that own person punya experience. Okay, and you have to remember that the workload, the people that work in each hospital change from time to time. So it's not fair for me. For example, I did my housemanship in HSA Johor Bahru, that was 10 years ago. For me to give a review to you all yang nak buat dekat HSA, okay, because the workload is different, the working environment is different as well. Okay, so be careful with hospital review. And usually, because I have encountered a lot of housemen, I tanya nak buat houseman dekat hospital mana? Oh, saya nak pergi hospital A. Okay, so rumah you kat mana? Oh, rumah saya jauh. Okay, so kenapa you pilih hospital A yang jauh tu? Okay, dia kata sebab I heard from my seniors, okay, that the hospital is good for housemanship training because all of the staff are very baik macam tu kan. So and especially in JB lah kan, JB ada 2 hospital untuk housemanship. Okay, so usually most of people from JB that I have encountered prefer to do in one hospital because they said that particular hospital is less busy than the other one. Okay, so if you choose certain hospital because you think it will be easy and it will be less busy, let me tell you that you will be disappointed. Okay, because housemanship is supposed to be busy. So far I tak pernah jumpa lah houseman yang dekat hospital yang tak busy. Okay, because you have to remember that KKM plan the manpower, okay, according to the workload of hospital. So kalau satu hospital tu bed number dia banyak admission, so they will send more people, more housemen, more staff nurse, more specialists. Okay, so compared to a smaller hospital, okay, district hospital, kalau bed number dia sikit, okay, so 300 bed compared to 2,000 bed, obviously the number of manpower is different because of the workload. Okay, and bed occupancy rate. Okay, first, so housemanship is meant to be busy and challenging. Okay, secondly, you cannot expect satu-satu hospital tu orang dia semua baik je. tak adalah. Okay, even if the working environment is relatively benign, okay, but if you do not have a proper attitude, you don't prepare yourself well, okay, you can turn these benign people into malignant people. Okay, so my advice is to focus on what you can change, okay, and what you can focus on is your preparation, you being near to your support system, okay, so that you can focus on your housemanship training well lah. Okay, so that is the first disclaimer. Okay, no specific hospital review during this session. Second, you have to remember that all the hospital review are biased and exaggerated. Okay, third one is I need you all to be clear that how much we learn during housemanship it's actually depend on the hospital or our attitude. What do you guys think? Okay, so so Faris Irfan bagi tahu, so how much you will learn during housemanship actually depends on your attitude and whether you are present at the hospital for your training. Okay, it doesn't really depends on the hospital. Okay, you cannot expect the hospital to teach you. You cannot expect the people in the hospital to teach you. Okay, so remember, the topic of our session tonight is choosing the best hospital for HOship training. Okay, HOship is a time for you to train, for you to put all your knowledge and skill into practice. Okay, so you cannot really expect the kind of passive teaching from ada semua orang suap dan bagi tahu you what you need to do, how you need to do things. Okay. So this is working life. Ini bukan macam medical school life, you datang dekat ward, you tengok, you tunggu you punya lecturer ajar, you tunggu orang lain instruct you to do something. No, this is working life where we expect you as houseman, when you come, you have a certain set of skills, basic skills, you have a certain set of basic knowledge for you to help us in managing patients. Okay, so you can clerk the common case, you can do basic procedures. Okay, and you know how to manage very common cases. Okay, okay, so remember, how much you will learn actually depends on your attitude and your preparation. Okay, so the aim of this session tonight is to correct your expectation. Okay, so if you have this particular hospital, so yang mention kat atas tadi kan, kalau your hospital is tertiary and is computerized, okay, so I will tell you what are your advantages and what are your challenges that you need to overcome. Okay, so if you choose a small district computerized hospital, I will tell you what will be your challenges that you will need to overcome. Okay, there's certain things you can prepare. There's certain things you need to do when you do your housemanship in that hospital. Okay, and what are your advantages as well. Okay, so our aim tonight is to know what to expect from our hospital. Okay. Okay, so JC Go asked, due to family coach have been working in other field and forget most of the medical stuff, is it too late to start revision? It's never too late to start revision. Okay, you can start your revision in your tapisan group. Okay, there's one particular tapisan group which is very active in doing medical related revision. Okay, you can flip through your undergraduate books, or you can go to my personal timeline or Medicorp YouTube channel. Okay, there's a lot of free video recording on what to prepare about housemanship. Okay, it's never too late to prepare. Okay, because Linesh, because we don't really practice during the waiting time. It is normal that we forgot certain things and certain set of skills. Okay. Okay, let's me go through. I think we have few questions. Okay, Hidayah Asmadi asks, is it possible they will combine two intakes in this upcoming HO? I'm not sure. Because kalau if they said they include until December intake, so that is about 1,000 people. Okay, so 1,000 people is large intake lah. Okay. Okay, Fazrin asks, which is better, secondary or tertiary hospital in terms of future outcomes? Okay, I will discuss about this later. Dr. RHO from larger hospital superior in terms of management and clinical skills than HO from smaller hospital based on your experience. Okay. Okay, very good question, Safwan. Okay, so let's see. Okay. Okay, so we are clear about our aim for tonight's session. We are clear that how much we will learn during housemanship is actually depend on our attitude and preparation, not the hospital per se. Okay, and I think you have understood that the best housemanship training, best hospital for housemanship training is actually the hospital closest to your support system. So usually the support system is your family. Okay, for some of you the support system is your brotherhood forever or close friend during university. Okay, it's okay. Cumanya waktu tagging ni, it is very critical to have a support from your family in term of emotional support, sebab you akan keluar pagi 5 a.m. or 6 a.m. in the morning, you will come back late. Okay, so ada issue with high risk of micro sleep if you drive by yourself. Okay, and you actually need people to take care of you. Okay, macam take care of your apa ni, baju, siapa nak basuh, siapa nak gosok, siapa nak masak kat untuk you, and siapa nak bagi emotional support. Okay, after a long tiring day and you need support and you need word of encouragement. So the best emotional support and word of encouragement and food and also jaga baju you apa semua is obviously from your family lah. Okay. Also and I have encountered a lot of housemen who regret choosing a hospital far from their home. Okay, this includes the guys okay, as well, and sadly some of them actually have to resort up to resigning from HOship and they plan to redo in a hospital near to their family support system. Okay, so don't take this support system lightly. Okay, walaupun you rasa you are very adventurous or very independent, okay, it will be much easier for you to do it when you are close to your loved ones lah. Okay, so remember that. So how close is okay, the best is if you can stay with your family during the training. Okay, but kalau tak possible, if within the same state, okay, means kalau you post call ataupun you post night, you kerja malam, so you are not too tired, then esok you feel like want to meet your family, then 1 hour plus drive is acceptable lah. Okay, tapi kalau you duduk dekat KL, family dekat Kelantan kan susah nak balik. Okay, susah nak arrange to meet them. Okay, so please take this point importantly lah. So how far is far? Syafiqah tanya. How close is close? Within the same state, okay, or within 1 hour drive with your family is okay. Okay, so kalau 1 hour drive tu boleh lah seminggu sekali balik ataupun sebulan sekali 2 kali balik. Okay, and most importantly, if you need your family, kalau you tak boleh, if you cannot go to back your family can easily come to you lah. Okay. Okay. Okay, so Hashraf Zan tanya, possible ke nak dapat hospital sama waktu HOship? And Adlina pun tanya, soalan yang lebih kurang, betul ke there is high chances we stay at the same hospital sampai kerja di floating and contract MO? Okay, so untuk contract houseman, okay, so your housemanship is 2 years usually, hopefully no extension. Then you will have what we call a floating period before you know your final posting as MO. Okay, so this floating period could be 1 or 2 months. It can last up to 1 year. Okay, so during this floating, yes, you will be in the same hospital. Okay, for university hospital, some university hospital habis housemanship tu you need to float at the nearest KKM hospital. So yes, you will stay longer in your hospital which you did your housemanship. Okay, so it's more waktu housemanship tu memang 2 years, and during your floating. So floating could be few months up to 1 year lah, depending how fast KKM decide your final posting as a medical officer sebelum ni, atau pergi KK ke district ke, so you will stay in your hospital first. Ya, Hidayah sebenarnya ada floating yang tak adalah almost a year lah, 9 months macam tu ada. Okay. So Muhammad Irfan, is it true choosing Sabah Sarawak have better chance to get permanent MO? Untuk housemanship tak ada. The latest trend is if you are the latest trend for the latest few batch of contract MO. Okay, so a few yang being offered permanent post are those who get their posting to Sarawak. So kalau they are offered to go to Sarawak and they accept the offer, so they are granted permanent post. Tapi tak semualah. Okay, tak semua pergi Sarawak tu dapat permanent post juga. Okay. 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 So okay Kam. So I think dah 3 people asked the same questions. In terms of learning and gaining experience during housemanship, will a tertiary hospital allow us to perform advanced procedure like intubation and what is CCT, Joel? Okay. Okay, I answer Adina questions first. Okay, so follow up question, adakah kita patut pilih tempat yang kita nak settle down terus rather than apply nanti bila kita dah habis houseman? Okay, I would recommend you to pilih terus hospital yang you nak tak adalah settle down. Okay, sebab biasanya housemanship ni, MOship ni biasanya you kena tukar state. Usually you'll be posted to different state. Okay, but it is crucially important to be near your family during housemanship. Sebab bila you MO nanti you are more independent, you are emotionally more stable, and you are financially more stable jugalah, hopefully. Okay. Okay, Joy. Okay, chest tube thoracostomy. Okay. So to answer Joel questions, okay. So that brings us to the first point on what to expect from your hospital. Okay. So you all need, first and foremost, okay, you need to understand how KKM choose certain hospital. Okay, kita tengok the list of 49 hospital kan. Actually in Malaysia we have 100 plus hospital including a district with no specialist. Okay. So, kenapa 49 hospital ini sahaja dipilih untuk train houseman? Kenapa houseman kan ramai? You all kan tunggu lama. Kenapa dia tak bagi je all di 100 lebih hospital tu semua train houseman? Because only hospital with good case mix. Okay, so case mix is a mixture of cases that HO need to know. Okay, so also all the 49 hospital ni yang boleh train houseman ni is because first they have enough specialists in each department. So each department yang nak train houseman tu must have at least 6 specialists. Kena ada 6 pediatrician, 6 surgeon, 6 internal physician, baru dia orang boleh train houseman. Okay, secondly, they will need to have enough number of cases. Okay, so kalau you all tengok you all punya logbook kan, okay, we have went through the HO logbook quite a few times during our previous teaching session. Okay, so you tengoklah kalau ONG ada normal labor, ada PIH, GDM, okay, then orthopedic adalah the list of cases you need to know and the list of procedures. Okay, so all these 49 hospital have all that procedures done regularly and have all that common cases admitted into their hospital regularly. That's why they are accredited to train housemen. Okay, so now you by understanding this fact, okay, so all hospital, regardless it is secondary or tertiary, will have enough exposure. Bukan ada enough, will have enough case mix, okay, or mixture of case that HO need to know, and they will have all those common procedures to be done by housemen regularly as well. Okay, so like what Joel asked, okay, intubation is compulsory performed by housemen. Chest tube, if I'm not mistaken, is compulsory observed. Okay, so usually it will be done by your MO lah. Okay, and you will need get opportunity to assist or observe. Okay, so this procedure ada in all hospital. Okay, so tak ada isu lah. Okay, kalau hospital tu besar, banyak kes, lebih belajar. Kalau hospital tu kecil, tak banyak kes, tak boleh belajar, it's not true. It's not true at all. Okay, so okay, actually, if your hospital is large, tertiary hospital, okay, you will have more wards. Okay, and houseman, you akan bertukar-tukar lah dari satu ward ke satu ward yang lain. Okay, for example, let's compare a large tertiary hospital. Okay, the medical department. Okay, a tertiary hospital, the medical department have 20 wards. Okay, compared to a district with specialists, which the medical department have only 2 medical ward, male and female. Okay, so if you are houseman, okay, one houseman do in tertiary ward, a tertiary hospital, and one houseman do in district hospital with 2 wards. Okay, what do you think about their exposure? Okay, so remember the complexity of cases are the same, number je lain. Okay, this is both hospital have the same cases. Okay, cuma yang hospital besar tu banyak lah number state, yang ni kurang sikit. Okay, but the same mixture of case. Okay, but okay, this houseman yang dekat hospital yang kecil ni, okay, dia hari-hari tengok patient yang sama sebab dia hari-hari duduk dalam ward yang sama. Okay, compared to another houseman yang buat di hospital yang besar, tertiary, every day they have to in charge in different ward. Hari ni kat ward A, esok kat ward B, esok ward C, ward D, ward E. Okay. So when you are posted to different wards, okay, the continuity of patient care is lost. Okay, so that could be a challenge if you are doing your housemanship in tertiary large hospital. Okay, so you'll be posted to different wards, and you have a lot of subspecialty. When you have a lot of subspecialty, it means you will be referring to a different subspecialty. Okay, so biasanya bila dah refer ke different subspecialty ni, mungkin kena tukar ward ataupun the managing team change, so you don't have access to that case anymore. So the continuation of patient care, and it also in terms of exposure for you to that particular case is limited. Despite you're doing in a very large hospital, okay, with a lot of cases, okay, but you are seeing a limited number of case every day because you're posted to a macam a particular ward, okay, and you'll be referring a lot to other subspecialty. Okay, so if you are in tertiary hospital, this is your challenges. It's quite difficult to appreciate the continuity of patient care, okay, because you keep changing from one ward to another, okay, and also you'll be referring to a lot of subspecialty. It means you have to be really proactive, okay, to follow up your patient. If you refer your patient to another team, you will need to follow up by yourself. Okay, patient tu apa jadi dekat dia, how do you all manage? So that will be your challenge. Okay, compare, let's get back to the small hospital, the houseman in only male or female medical ward. Okay, so this houseman, despite the hospital have lesser number of case, this houseman see the same patient in the same ward every day. So they actually see the patient, fresh case from admitted. They see the same patient every day until the patient has been discharged. So they really appreciate the continuity of patient care. Okay. And based on my personal experience, when I compare the confidence level of managing common cases that HO supposed to know, okay, usually those who did their housemanship in a small district hospital have more confidence and more skills in managing the common cases that HO is supposed to know. Okay, so remember, your aim of housemanship training is for you to know how to diagnose, how to manage common cases, not all the fancy, very rare syndrome. Okay, that is level of your specialist or your consultant. Your level is to manage common cases, AEBA, a normal labor, conducting delivery, okay, in pediatric is febrile fit, AGE with dehydrations, okay, open fracture, closed fracture, okay, because if you are in district, SMO later will be posted to district and klinik kesihatan, so you will need to manage these common cases and you need to know how to attend and resuscitate them before you transfer them to a specialist center. Okay, that is your secondary or tertiary center lah. Okay, so remember, your aim of housemanship training is for you to know how to manage the common cases, not the fancy case. Okay, and these cases are readily available in any hospital that train housemans lah. Okay, so okay, that is exposure in terms of training or complexity of cases. Next is opportunity to do procedures. Okay, so okay, in terms of opportunity to do procedure, I've mentioned before, all the procedures that compulsory perform by houseman. Okay, so compulsory perform ni, contoh untuk medical is taking venous blood, ABG, then your branular insertion, your ECG, your nasogastric tube. Believe me, you have a lot of this procedure done every day in any medical ward, in any hospital. Okay, it's just depend on you whether you want to grab the opportunity to do this procedure. Okay, but for compulsory observe or assisted procedure, so these are more invasive procedures. So chest tube, long line insertion. Okay, so this is not common. It's not macam bukan hari-hari lah kita chest tube kan patient kan. Okay, unless you dekat ED. Okay, not every day you do peritoneal tapping. Okay, but at least usually in every week we will have a few cases. Okay, and you will still have the opportunity to observe this procedure. Okay, regardless of where you are posted to lah. Okay, so and regarding the procedures, okay, okay, so during Medicop punya physical, before the COVID area lah, okay, so before the COVID area, we have physical course kan, we have a surgical course, we have pediatric, we have ONG, everything, and each courses have speakers from different hospital. So the common question is, participant always ask each of the speaker, doktor punya hospital kan, houseman boleh buat procedure tak? Houseman boleh buat procedure tak? And I recall hearing the almost all speakers answer like this. Banyak je procedure dekat saya punya hospital, tapi houseman jarang sangat volunteer because they didn't volunteer. So usually MO and specialist will do that procedure themselves. Okay, so opportunity to do procedures, procedure tu ada je kat semua hospital, banyak atau sikit je. Okay, and you will need to sacrifice lah. Okay, contohnya macam in pediatric, exchange transfusion for severe jaundice, tak adalah setiap minggu ada, mungkin sebulan sekali. When you know there's that particular procedure, okay, regardless you post night ke pre-night ke, so you might want to come outside your working hours to observe that procedures, okay, because it's quite rare lah. Okay, okay, and next you have to volunteer for that procedures. Okay, so macam mana nak volunteer ni? First you need to be a good houseman lah, means you settle your ward work, you know that procedure, then only when you volunteer, I trust you and I will let you do the procedure. Okay, so no worries about the procedures. Okay, the compulsory perform banyak, just the compulsory observe and compulsory assisted tu is lesser because they are more invasive. Okay, and most medical officer prefer to do themselves because it's more safe lah for them to do it on their own. Okay, but if you're a good houseman and you volunteer for that procedure and you know that procedure well, okay, usually your MO will allow you to do with direct supervision. Okay. Okay. Before we move to next point, okay, on workload, Ashraf asked hospital ada hostel atau quarters ke atau certain je? Most hospital have hostel or quarters. Cumanya dia punya condition tu berbeza-beza lah. Okay, and availability kadang-kadang penuh. Okay, so you need to ask around. Okay, I have made a compilation of hospital punya hostel and quarters punya condition and rate. Okay, I will share the link again in my Telegram channel tonight lah. Okay, so you can see. Okay. So okay, next is workload. Okay, so biasanya kalau kita pilih hospital ni, we are hoping that the workload is less lah. Okay, logically kan. Okay, so okay, workload. So what actually determine the workload in any department? What do you think? Apa yang menentukan department ni banyak kerja ke kurang kerja? Okay. Okay. Before that, okay, before the workload, okay, we have a good questions here from Adrina. What are your thoughts on doing our housemanship in hospital that manage COVID patient? Cause I heard that the HO need to be transferred to other department, to other hospital for different department. Yes, this is true for Hospital Sungai Buloh currently. So I think it is best to avoid this hospital lah, because if you are posted to different hospital for different posting, it will be quite challenging for you to arrange the logistic. Okay, where to stay, where to nak kena drive ke different tempat apa semua, and you have to readjust yourself to the new department or new work environment. That will be quite challenging lah. Okay, so you might want to avoid that. Okay. So come back to our questions. What actually determine the workload in our ni? Okay, I have a very interesting comment from one of our excellent MOs, Dr. Alia Nadira, okay, regarding the opportunity to do procedure. Okay, betul. Agree on houseman voicing out to volunteer. If I am doing UAV, okay, umbilical artery catheterization, okay, atau umbilical vein catheterization. If houseman come and observe, I'm just waiting for them, boleh tak assist? Okay, if they show volunteer, I would. Yeah. So usually, if you volunteer yourself, it shows that you are very proactive. Okay, so kita orang semangat sikit lah nak ajar. Okay, kalau you tengok je, I buat je lah macam biasa. Okay. Okay, so back to our questions on workload. What determine workload in your department? Okay, Izzati Jeffrey mentioned HO patient ratio. Yes, that's true. Kalau patient ramai, houseman sikit, your workload will be higher. Aimi Hassan, functionality of houseman. Yes, betul. Kalau ramai houseman function, your workload will be less. Okay. Aiman shared teamwork. Correct. Okay, if you have a good teamwork, okay, so workload is shared evenly among housemen. Okay. Patient turnover rate, okay, betul. Patient turnover rate ni means numbers of admission and number of discharge. Okay, so when patient turnover is high, especially in medical department and ONG department, you have a lot of admission every day and you have a lot of discharge as well. This reflect in more workload because you have to clerk more patient, you have to do more procedure on admission, more blood taking, more referrals, and more discharge summary as well. Okay. Okay, so the most correct answer is by Citizen patient to functional HO ratio. Okay, so remember, if you are a good or proactive houseman, you masuk department tu, you become a functional houseman, then the workload automatically will be lesser. Okay, kalau ramai-ramai houseman pun tapi semua macam very calculative, berkira, okay, this is my patient, this is not my patient, this is your patient. Okay, walaupun workload sikit, you have to do it on your own, and the working environment tu jadi tak best lah. Okay, so having know that, okay, so dah tahu this fact, okay, so workload is depend on number of functional housemen we have at any particular time. Okay, that means you cannot really predict the workload, betul tak? Okay, yang kita boleh tahu is general rule lah. If you start in ONG or you start in medical, usually the workload is more because of higher turnover. And next is if you are you are posted to a certain department, waktu tu tengah sikit sangat houseman dekat department tu, so yes, workload will be more lah. Okay, so remember, prepare yourself for housemanship. Try to be as functional as soon as you can. So at least kalau you masuk department tu, you boleh tahu ambil darah, boleh tahu isi borang, boleh tahu clerk common cases and present. That will be a great help to your colleagues. Okay, lagi-lagi dah lama tak dapat houseman. Okay, the last intake was in October. Okay, almost 4 months no houseman intake. So I think most of the department and most of the hospital are very lacking in housemen. Okay, so please prepare yourself well. Okay, focus on the basic things. Okay, blood taking, urinary catheterization, VE, conducting delivery in term of procedures, and the common procedure as listed in your logbook. Okay, how to clerk, how to review them. Okay, so hopefully you will come and reduce the workload. Okay, and remember, more beds, more patient, more manpower. Okay, so less bed, less patient, admission, less manpower. So actually workload is more or less the same in any hospital. Okay. Okay, so next is teaching or mentoring or training. Okay, mentoring of training. So what does it mean? Okay, this is one of the reason I personally prefer a smaller district hospital. Okay, compared to large tertiary hospital. Okay, because when you are in a smaller hospital, okay, so for example lah, in a one district hospital, the number of housemen in the hospital is 100 plus. Okay, so 150 lah, for example 150 divided into 6 posting. So you will have about 20 housemen in each department, and you will have about 20 MO as well in the same department. So when you have a 20 plus houseman and 20 plus MO, obviously everyone will know everyone. Okay, so dalam ward pun yang kerja, MO yang akan tahulah. Okay, sepatutnya 4 orang kan, so you will have a macam kita kata a personal, bukanlah personal connection, means people will know you. Okay, so kalau district smaller hospital ni, kita akan tahu lah, oh mana houseman yang baru, mana houseman yang lama, because the number is less. Okay, so MO you pun boleh tengok-tengokkan. Okay, you are new, right? Okay, so you all yang dah sini ni tolong ajar yang baru. Okay, we know each other. Okay, but let's compare to a tertiary hospital where you have 100 plus housemen in one department. So total dalam satu hospital tu you have 400 or 500 housemen at particular time. Each department will have up to 100 housemen. So housemen sama sendiri pun kadang-kadang tak kenal. apatah lagi MO nak kenal houseman atau specialist nak kenal houseman. Sometimes when you go to your assessment, end of posting assessment, specialist tu tak kenal pun you, tak pernah kerja dengan you because there's so many houseman in the department, there's so many wards in the department. Okay, so when there's so many housemen, the mentoring of training is not as intense as when you are in a smaller department where all the nurses know you, you know almost all the nurses, okay, and you know all the MOs and all the specialists and all the MO and all the specialists know you as well. Okay, so this kind of environment actually push us or indirectly motivate us to macam semua orang tahu kan you ada dalam department ni dah lama, so you need to perform, and it will bila in this kind of environment, the chances for us to missing in action atau tiba-tiba hilang daripada department tu pun kurang because everyone know you, everyone expect you to be there, okay. And MO akan notice lah if some houseman kenapa you punya kawan ni macam looks macam sad, not really perform. So we have that macam relation atau environment, okay, that will encourage us to learn, okay. And also ada possibility untuk UMO akan monitor you lah, okay. Sebab kalau teaching pun, if you're 20 plus houseman kan, is a room for 20 plus houseman, so kita akan easily notice if one houseman tak datang kerja ke, tak datang teaching, okay. So sebab senang kantoi, jarang lah ataupun kurang lah possibility untuk missing in action, okay. Tapi kalau you punya houseman tu, you punya department tu, satu department tu 100 lebih houseman kan, waktu teaching pun mungkin lah susah nak control but some hospital macam HKL sekarang kalau teaching kena ni ada scan QR code, so you cannot really, they have a proper method of monitoring your CME attendance as well, so tak boleh kirim buku je lah waktu CME Okay, so good question by Haziq Kamal. When exactly is the teaching session during HOship? Is it kind of on the go day-to-day work or is it CME? Okay, so your teaching session, you will have the teaching session you will have a CME. CME is a continuous medical education. Proper teaching lah means you duduk dalam bilik teaching, atau sekarang ni selama COVID ni banyak department buat online juga. Okay, so you ada designated time for teaching every week. Okay, for houseman that is compulsory. Your 16 mandatory topic tu must be covered in your weekly teaching, okay. And the 16 mandatory topic tu memang houseman kena prepare lah. You take turns. Biasanya satu department you have to present one topic from the 16 mandatory topics tu. So next week kawan you houseman lain pula present and you will take turns lah, okay. But okay, so you will learn a lot during the CME or proper teaching, but the bedside teaching during the rounds every day actually makes up more exposure. And you will learn a lot and you remember better when you see patients, right? Okay, so teaching ni ada dua lah, the CME, okay, and also your bedside. Okay, when you do rounds, when you assist procedures, when you assist operation, that is your teaching as well. Okay, so the teaching yang bedside ni and operation theatre, the so-called non-formal teaching, okay, actually really depends on whether you are proactive to complete your work and ask questions. Okay, so kalau houseman ni semuanya attitude bagus, round habis on time, so MO macam bila round tu tak banyak issue kan, so your MO and your specialist will have more time to teach you. Okay, so kalau you tanya soalan, then we have a luxury of time to teach, we will teach during the rounds. Okay, but the issue, it will become an issue if patient tak round pagi tak habis lagi, lepas tu waktu round tu banyak benda missing, result tak trace lagi, patient tak stable and houseman tak manage lagi. So it creates a lot of issues and we need to settle those issue. So we need more time. MO pun jadi bad mood lah kan, betul tak? Okay, sebab patient tak stable and we obviously won't have much time to teach you bedside. Okay. And remember, if you prepare yourself well, okay, if you prepare yourself well, walaupun orang tak ajar, you can learn a lot juga when you club patients, when you see how the patient is managed during rounds. Okay, so you don't have to be a passive teaching, orang ajar you satu-satu. We actually learn a lot by observing how the patient is managed. So that's why I always emphasize on basic knowledge. Okay, sebab kalau you ada some knowledge, bila you tengok, you akan faham, oh patutlah kita manage patient macam ni. Tapi if you don't have basic knowledge, you tengok orang buat pun kita macam tak faham kan. Okay, because we don't have basic knowledge on that management or on that disease. Okay, so that's why it's really important to prepare yourself so that bila you tengok patient to manage in such a way, oh patutlah dalam CPG cakap macam ni. Okay, so sebab tu kalau sebelum semua ni you baca buku tapi macam atau you baca CPG macam tak ingat, tak faham sangat, it's okay. Eventually when you see patient, you will understand and you will remember. And most importantly, you know where to refer back to. Okay. Beza kalau houseman yang tak pernah baca CPG, tak tahu pun CPG tu ada, dia tengok patient hari-hari pun, they cannot really appreciate the management. Okay, they cannot. Kalau if they attend, so waktu houseman ni, most of the management, okay, the principle of management, maksudnya decision to change antibiotic, decision to do operation, decision to discharge is made by the MO. Okay, so along the way, you should be able to train yourself to do what your MO supposed to do, because nanti you jadi MO juga kan. Okay, so for this training and effective training happen, you really need a basic and a strong, solid foundation of knowledge for you to understand what your team is doing lah. Okay. Okay. So sorry lah, I'm a little bit biased to a smaller district hospital because from my experience, it will give you more confidence. It will give you more mentoring of training. Okay, what example of smaller district hospital? So this is all not the state hospital lah. Okay, so if I were to mention quickly, it's Kulim, Kanga, mana Manjung, Teluk Intan, okay, Kajang, Shah Alam, Kuala Pilah, Segamat Muar is between dah nak jadi tertiary juga, okay, and then Kuala Kerai, Tanah Merah, okay, Bintulu, Tawau, Sandakan. Okay, so that is so-called a smaller or district hospital. Okay, all the state hospital are tertiary, and most of hospital in Klang Valley are tertiary hospital lah. Okay. Okay, so Tengku Nur Syahadah asked, okay guys, we will end this session much later. So mungkin lagi setengah jam minimum because you all have a lot of questions. So please bear with me. Okay, so Tengku Nur Syahadah, does choosing district hospital can affect our future career pathway compared to tertiary hospital? Okay, so as you all know, I'm really prone to recommend a district hospital. But if hospital dekat dengan rumah you tu memang tertiary, then go for tertiary and you already know what to expect. Okay, so no issue kan. How much we learn to depend on ourselves kan, not our hospital. Okay, and you know what to expect and you know how to overcome the challenges. No issue. Okay, you jangan nak pergi district jauh-jauh pula because I promote the district hospital, no. Okay, so Tengku Nur Syahadah, okay. The only reason that I would recommend or I support you to go to tertiary hospital is when, first, tertiary hospital yang mana dekat dengan rumah you. Second, you have a specific interest in certain subspecialty. Okay, contohlah you daripada kecil, daripada tadika, sekolah rendah, sekolah menengah, you memang nak jadi neurosurgeon ataupun you nak jadi ped surgeon. Okay, so this subspecialty is not available in all hospital. Okay, so you might want to go to a tertiary hospital with this subspecialty so that you boleh tengok lah, you can expose yourself to that specialty. So you tengok lah kalau MO neurosurgery, specialist neurosurgery, what is actually their their job scope, what are the cases that they have to manage. Okay, first you want to expose yourself to that department. Secondly is you want to bila you buat houseman at that particular hospital, you can be MO, you can floating at that particular hospital, so you can introduce yourself to that department lah. So for example, kalau you wanted to be in neurosurgery, okay, so you can ask your surgery HOD, the surgical based HOD ataupun specialist to give recommendation to Department of Neurosurgery that you are an excellent houseman, you have a deep interest in surgical based department, and that will increase your chances to be a medical officer in the neurosurgical department which you have a deep interest in. Okay, so yes, that could be one of the factor if you want to choose a certain tertiary hospital. Okay. Okay, Haziq again. Okay, when we see and clerk patient, are we allowed to make plan of management? And if so, what extent are we allowed to? Okay, so yes, bila you clerk case, you are allowed to do a plan of management. The common ones is first, okay, usually nowadays, patient yang sampai ward tu dah destabilize from ED lah. Okay, most of the time patient are quite stable when they arrive to the ward. Okay, and most of the patients also are already been seen by your medical officer in the ED. So usually MO dah buat plan, you only execute the plan. Okay. Okay, tapi the extent of plan yang HO are allowed to do is you can decide on the ventilation lah. Kalau you nak bagi face mask, you nak bagi nasal prong, you nak bagi face mask boleh. But for high flow mask or more invasive airway, you need to inform your MO. Means the patient is not stable lah. Okay, IV drip, you need to know. You can give IV drip if indicated, but you need to know how to calculate and what type of drip lah. Okay, and then medication, yes, you can start medication to patients. Okay, so usually patient are admitted for infection and pain kan. So you need to know your analgesic, you need to know your antibiotics. Yes, if you know the dose, you know the indication and contraindication, you can prescribe. Okay. And monitoring. Okay, so this is a venom formula, ventilation, oral intake or IV drip, medication. You can start medication for antibiotics and analgesic. You need to restart patient punya previous medication. Okay, and the monitoring. Obviously, you can make a plan of management to monitor input-output chart. Glucometer, okay, how frequent you want to repeat the blood taking, for example dengue, nak buat the FPC TDS ke, okay, every 6 hourly ke, okay. So yes, houseman need to know how to make plan. Okay. Okay, Haziq Kamal, in case of HOship Tertiary Hospital, I'm planning to publish case report. Boleh. Actually, you tak semestinya you dekat hospital university je. Any specialist can help you with publishing reports. Okay. And you will have tak ada isu. Tak semestinya dekat university hospital je. Okay, I have encountered a few housemen yang buat housemanship not in hospital university, but they still publish paper with help of their specialists. Okay. Crystal Tan asked, Putrajaya is state hospital. But tak banyak bed sangat. Okay, I'm not sure the bed number. Okay. It's tertiary hospital. Okay. Sekejap. Okay. Good questions by Uwais. What are your opinions about HO receiving sexual harassment? You need to any bullying or harassment in terms of physical or sexual, you need to make a report lah. Okay, so you can make a report to your pengarah hospital. You can make a police report as well. Okay, or you can, if you're afraid, you can make report to another body. We have MMA help dog platform. Okay, where you can make a report and they will investigate accordingly. Okay, so if you feel safe, feel more safer to report to someone outside of your hospital, okay, you can contact help dog. Okay, yes, I have our excellent MO supporting my statement. Yes, I expect house officer, Dr. Alia Nadira is medical officer in pediatric. Okay, she is one of our speaker for pediatric online course as well. So I had expect house officer to create their own plans for new cases when they clerk the patient. You are a doctor and you are training yourself to be a medical officer. Okay, but usually sebab you all new houseman kan, new houseman, before you even execute the plan, you need to present the case to us. Okay, so it's a safety net lah. Okay, so let's get back to our next point. Next is okay, working environment or malignant seniors. Okay, so yang ni lah you all dengar, alah department tu, hospital tu banyak orang malignant, hospital ni banyak orang baik. Again, remember you have kind people everywhere and you have bad people everywhere as well lah. Okay, so our aim is to make sure the benign one don't turn into malignant because of our attitude or ignorance. Okay, and if you're good, you are good. Okay, so malignant people ni, they are everywhere. Usually they are not many lah. Okay, and along the way you will know how to tackle them or how to avoid them. Okay, so don't worry. Usually yang cerita pasal malignant ni is a bit exaggerated, and remember the manpower pun bertukar-tukar kan. Okay. Haziq, all hospital got malignant, you cannot run for them. Yes, betul. Our aim is just to keep the benign people benign throughout our training. Okay. Okay, Lee Hao-ran, is there any prejudice toward overseas grad HO, particularly Russian graduate? If so, how to overcome? Okay, actually, nowadays we don't really differentiate lah. We don't really tak kisah pun you graduate daripada mana-mana. Okay, what speaks for yourself is your attitude. Okay, what speaks for yourself is your attitude and proactiveness to learn. Okay, so we have a lot of good house officers from overseas. We have a laid back house officer despite they graduate from local university. Okay, so don't worry about that prejudice. You cannot change. You cannot what people think of you is not something that we can change. It's not within our circle of influence, but make sure you have a very good attitude and you improve so that their perception toward us is okay. Okay, sharing my experience. I graduated from Russia, Volgograd, and in my hospital during my batch, okay, ni macam masuk bakal angkat sendirilah, but the excellent ones are those who graduates from Russia and a few local universities. Okay, so the perception is formed by the HO attitude. Okay, don't worry about what people think about you lah. Okay. Okay. So, okay, don't worry about malignant people, okay? We learn how to deal with them every later lah, okay? Okay, and another thing I need you all to remember that usually okay, I never condone scolding, okay, but usually any scolding that we receive during housemanship is because of our own mistakes. Okay, it is directly due to our mistake or our negligence. Okay, so please take that scolding as an opportunity to improve yourself. Okay, so kalau kena marah tu usually kita je ingat kita kena marah. Orang yang marah kita tak ingat pun. Okay, if you improve along the way, their perception will change. Don't worry. Okay. Okay, JC go. My experience from working in other field, millennial people is everywhere, not in medicine, medical fraternity saja. Okay, so we need to be strong. Okay, and try to not being affected emotionally and mentally lah. We will cover this in next week session on how to prevent how to manage stress and preventing burnout. Okay, we will have a speaker from psychiatry department, okay, to talk about this, okay, in 2 weeks. Okay, Izati asks, I'm living far from hospital. Should I prepare a rental house or can wait for hostel? Okay, so nanti saya share semula link untuk Google dekat Google spreadsheet about hospital punya condition and availability. Some hospital you boleh call awal-awal tanya ada ke tak nak book. But most hospital bila you report duty to that hospital baru you boleh book dia punya hostel lah. So my advice is tengok you punya choice of hospital tu and you survey around lah whether they have hospital, whether it is available, whether the condition of hostel is good. Okay, then you decide whether you want to rent or you want to stay in the hostel lah. Okay. Okay, Arul Mati asks, will our placement for MO be affected from the choices made for location for HO? Okay, so usually you will need to change state. Okay, so kalau you buat dekat Selangor, usually you cannot stay in Selangor lah. That is the usual trend. Okay, so we cannot really predict this. Okay, sebab you can apply bila MO, you can apply to do in certain states, but it depends on the vacancy. Okay, which state need MO more at that particular of time. Okay, so KKM will decide on the depending on which state need more manpower lah. Okay, so it doesn't really reflected from your HO posting. Okay, so next is computerized versus traditional or traditional system lah. Okay, so traditional is hybrid versus computer. Okay, so this is actually a personal choice. Okay, so those techno savvy people will prefer to go to computerized. Okay, I personally prefer traditional because I was trained in traditional hospital. Okay, so when I did a survey, so I asked my colleagues who has experience in both computerized and traditional hospital. Okay, because I only did my training in traditional hospital, so not fair for me to choose lah. So I asked people who has experience in both computerized and traditional hospital. So most of them actually prefer traditional or non-computerized hospital. Okay, because first, if you are doing your housemanship in non-computerized hospital, your adaptation will be much easier. Okay, there will be less technicalities. Okay, sebab tulis je kan tak payah nak tweak in the system. Okay, so it will be much easier to adapt during tagging in a traditional hospital. Okay, and but in the long run, kalau traditional hospital ni, you will need to do a lot of thing manually lah, nak trace all the notes. So kalau computerized, waktu you nak adapt tu, it will be quite challenging, but in the long run, it will be much easier lah because everything is in your computer. But usually But usually a computerized hospital dekat Malaysia ni apa ni, kadang-kadang komputer dia tak banyak. Okay, so when not all computerized hospital have laptop readily available during rounds. Okay, so kadang-kadang yang ada komputer tu dekat you punya nurse station je. Okay, so you tak ada laptops that you can bring during your rounds. So kalau tak ada laptops tu means during rounds you have to jot down everything. After round you have to document everything. Okay, kalau you buat kerja pun macam tu, you buat kerja dulu and then you have to document. So be macam redundant works lah. That's why most of the people that I've asked, they said baik traditional. Sebab traditional you tulis sekali je sudah. Kalau komputer ni, waktu round you kena tulis, lepas tu you kena type. So double documentation. Okay. That's why most people prefer traditional lah. Okay. And in terms of training, I think traditional hospital is better because traditionally you kena tulis kan, you have to think what to write. Okay, computerized ni most of the time it make us macam copy paste without really think what we document in the case notes. Okay, so ada copy paste and edit is allowable lah, tapi if you simply copy and paste without reading and summarizing your patient punya details, okay, it makes first harder to remember your patient. So I've encountered quite a number of housemen yang start in computerized hospital, they have issue with remembering cases. So bila I sit down with them, the issue is actually they copy paste the review, so it is someone else punya story documentation. They don't really reclass the patient, so that's why it is quite difficult to remember the case. Okay. Bias sangat doktor ni traditional, betul, because I was trained in traditional hospital and I have received a lot of complaint from those who did housemanship or HOship in computerized lah. Copy paste kadang-kadang kan some houseman yang ni yang tak bagus sangat lah. Okay, pagi-pagi tu dia tengok komputer dulu, dia siapkan dia punya documentation, baru dia tengok patient. Okay, so that is a very very bad habit lah, because review tu you kena tengok patient dulu. Yes, satu lagi, yes, Muhammad, thank you. Computerized hospital susah one system down. Yes, kalau dia down few hours pun you dah susah hati. Kadang-kadang boleh down for a few days or few weeks. Okay, so you have to rewrite everything, then after few weeks you have to retype everything. So extra work. Okay. Okay, so let's see from our medical officer. So Dr. Alia, again I did HO in computerized hospital and MO in traditional hospital. I did not like the computerized hospital because of a lot of technical issues. Okay. First, not enough computer. Okay, so you kena berebut. Second, computer suddenly shut down. Okay, so you tengah type or you tengah clerk, tiba-tiba you have to retype or reclerk. Okay. And copy paste so rampant, I've told you all. Okay. So kalau your hospital of choice is computerized hospital, so you need to remember. Try not to copy paste bulat-bulat. Try to reclerk patient, re-summarize and retype the summary of your patient in your own words so that you remember your patient better. So computerized hospital you need to come much earlier because you nak berebut komputer tu. Okay. And you will yang nak pergi computerized hospital, belajarlah type laju-laju sebelum start houseman ni. Okay. Okay, Darren. Okay, if we do HO in computerized hospital, can we snap photo so that we can learn for the next review? I think okay as long as you don't share it with other people. Okay, but one of the advantage of you punya computerized hospital ni, you boleh macam we call that pre-chart lah. Okay, so you can make a template. You dah siap type the template, bila you pergi dekat patient, then you kind of fill in the blank. So you don't have to macam kalau traditional ni, every time you pergi patient you have to rewrite everything kan, you have to rewrite every single thing. So okay, but if you're in computerized hospital, you can, we call it pre-chart, means you make a template. Okay, when you see a patient you fill in the template. Okay, so that's kind of save your time lah. Okay. Okay, Haziq, I'm wondering, how do we refer cases in computerized hospital? Okay, I'm not sure. I don't have experience, but usually your ward punya phone tu is next to your ward punya computer, so you can actually refer to the computer. And sometimes what the houseman do is they either print the case, patient punya case note, or they have their own summary of the patient's punya detail, so that can that will help them to refer lah. Waktu refer tu boleh waktu refer kat MO tu boleh tengok you punya summary yang you buat sendiri atau you print patient punya case note lah. Okay. Okay. Okay, Rakesh, is there a list of computerized, traditional and hybrid hospital? Okay, tak adalah, sorry. But you can simply ask in the Telegram group. So usually the computerized hospital is the new hospital. So hospital yang baru-baru masuk dalam list tu is the computerized lah. Okay, Shah Alam computerized. HKL is a mix of computerized and traditional. So in HKL, the ONG and pediatric, the new building is computerized, but the rest of it is traditional. So that will be a big plus point if you want to go to HKL. Okay, so you can experience both system. Okay, and another advantage if you want to go HKL is biasanya confirm dapat lah sebab banyak placement dibuka. Okay. So, okay, choose wisely. What's important is, you know, if you are in computerized hospital, what are your challenges? Okay, if in a hybrid hospital, what are your challenges? Okay, Darren, Putrajaya is definitely a computerized hospital. Okay, kalau dekat Klang Valley, computerized hospital is Selayang, Putrajaya, Ampang, Shah Alam, Sungai Buloh is computerized hospital. Okay. Okay, next is rate of extension. Okay, so ni related to the malignant atau tidak lah. Okay, so rate of extension. Years ago, we know some hospital or some department which have significantly higher extension rate. But nowadays, I think for the past few years, especially after the CCP system is implemented, the Certificate of Completion of Posting or CCHT is implemented for the past 2 or 3 years. Okay, so the rate of extension ni jadi lebih kurang sama. In all hospital. So nowadays, if I ask any houseman from any hospital, banyak tak houseman kena extend dekat hospital you? The answer will usually be yes, ada yang kena extend, but usually they extend themselves. So extend themselves ni means houseman tu yang tak hantar logbook on time, dia tak buat assessment, okay, ataupun dia ambil cuti lebih. Okay, so because of the contract system, your medical officer and specialists are very particular about extending houseman. So kalau boleh kita nak extend houseman, because once you are extended, means you have a lesser chance to be absorbed into permanent. Okay, so usually sekarang memang mana-mana hospital pun banyak houseman kena extend sebab houseman itu sendiri tidak hantar logbook on time, tidak approach specialist untuk buat assessment. Okay. So be careful with your reason for extension lah. We have covered that in our previous session. Amir Zakwan, HOship in hospital ATM? No, only for UPNM graduates. Graduates from University University Pertahanan Nasional. And also if you are MINDEF, Ministry of Defence Scholarship student, baru you boleh pergi dekat hospital ATM. Okay. So no issue about after rate of extension Okay, so to summarize what we have discussed so far, so the best hospital for HOship is the one closest to your support system. Okay, and next point is how much we will learn during housemanship actually depends on our attitude and preparation, not the hospital itself. Okay, and then I hope you have a better clarity on what to expect from your hospital, okay, in terms of exposure, okay, in terms of opportunity to do procedures is more or less the same for all hospital. Okay, in terms of workload, okay, sama juga. Just make sure you are ready for housemanship and you can help to reduce the workload in your department soon. Okay. And then I hope you know what are the challenges and what are the advantages for your hospital of choice or hospital nearest to your support system lah. So let's recap. Tertiary hospital, okay, you will have a lot of housemen, so you need to be very independent and very proactive on your training, okay, sebab ramai-ramai housemen tak ada orang lah yang akan tengokkan you dah berapa hari tagging everything, okay. So okay, that's for tertiary hospital. Okay, so tertiary hospital, you have a lot of wards. You need to work on the continuity of patient care. When you are in charge in different wards, so you need to be proactive to follow up that patient lah, okay. And if you refer your patient to a different subspecialty or department, you need to be proactive to follow up that patient as well. Barulah you boleh appreciate the continuity of patient's care, okay. So untuk smaller district hospital, okay, so relatively better working environment, more mentoring of training, but because it is a small district hospital, usually tak banyak lah vacancy dibuka, okay. So still the best hospital is the hospital near to your support system, okay. So in terms of computerized or not, so computerized, a lot of technicalities when you are new, okay, in long run it will be easier to trace result, but there will be redundant workload, redundant documentation, okay. So if you're a traditional hospital, you have to do a lot of manual manual tracing of the files, okay. You have to rewrite everything for all your patient, but that will be a very good training for housemanship lah, okay, because you want to write, you have to think for your patient and you remember better. Okay, and regarding hospital universities, okay, generally better working environment, okay, but hospital university are tertiary, highly specialized, okay, because they have a lot of consultants. So when you have a lot of wards and a lot of subspecialty, this actually might reduce your exposure towards the common cases that HO is supposed to know, okay. And I know one of the university hospital actually don't rotate the houseman to operation theatre because all the OT cases are very complicated cases, and almost all the operation are done by the MO, registrar and a specialist and consultant only. So houseman tak masuk OT lah. It doesn't require to be in operation theatre. So that kind of reduce your exposure for me lah. Okay. Okay, Angela Young, what is the percentage of becoming a permanent MO? It differs from batch to batch. Okay, and this is we have lesser permanent MO not because houseman tak bagus atau contract MO tak bagus is just because we have no more permanent post available. Okay. Okay, any more questions? Okay, one of our excellent houseman, Dr. Inamul Hassan, come to Sungai Petani, great learning opportunity. Mixed review, both computerized and manual, depends on posting. Okay, so Dr. Inamul Hassan has just produced a case report, okay, with the help of his specialist. Okay, so you don't really have to be in a computer university hospital to publish a case report or research. Okay. Okay. I think I have answered all most of your questions, the important ones. Okay.